So it's July 1996. It's a really hot day, and I go into the golf club at Haddon Hill. There are a couple of guys there, older guys, and one of them, seeing me, turns to his friend and says, pointing at me, "This man saved my life." I stumble over my greeting, embarrassed. I hadn't saved his life at all. It was Norman, who I'd seen a year earlier. He'd come to me with back pain. Back in those days, we didn't have access to MRI scans, and I had an X-ray unit in my clinic. And in order to keep the exposure to a minimum, we used to strap the patients to the X-ray unit to compress them to reduce the exposure. When I was strapping Norman to the X-ray unit, he said to me, "I can feel a pulsation in my abdomen." My heart sank. I hadn't even examined his abdomen. So, trying to wrestle some dignity from the procedure, I said to him, "I'll have a feel of your abdomen once we're done taking the X-ray." Sure enough, once we were done taking the X-ray and I did feel his abdomen, I could feel a pulsation too, but he was the one that had detected it. So what did we see on the X-ray? Well, you can see his spine, you can see the pelvis, you can see his hips, but more interestingly, you can see this bulge, and this is a bulge of his aorta, the largest blood vessel in the abdomen. He has an aortic aneurysm, and so I was really lucky to detect that. An aneurysm is a bulge in a blood vessel, and they're pretty common, but the worry about them is if they get large, then the large ones can rupture, often with fatal results. So we want to detect patients with larger aneurysms and send these patients to the hospital for repair of the aorta in order to prolong their life. So in order to do this, we need to feel patients' abdomens to try and pick up pulsation in the abdomen, although it must be said that not every aneurysm can be felt. These days I use ultrasound to look at patients' aortas, and we can measure the size of the aorta. You can see the aorta here in cross section, and really anything over the size of 3 centimeters is something that we want to get looked at by the hospital. They like to monitor aneurysms that are more than 3 centimeters to see if they are enlarging, and if they get to 5.5 centimeters, then really the hospital is thinking about doing surgery in order to prevent the aneurysm from rupturing suddenly and bringing about the sudden demise of the patient. Who's at risk of getting aneurysms? Well, typically it's an older male who either smokes or has smoked in the past. He might have high blood pressure and probably overweight with high cholesterol levels as well. But the second reason why we're interested in feeling the abdomen for aneurysms and scanning the abdomen is to see whether this might be a cause of a patient's back pain. Now, this is a controversial subject, and there are authors who think that aneurysms can cause back pain, and there's certainly plenty of sort of anecdotal cases where aneurysms have been picked up on cases where patients have back pain, but correlation is not causation. There are loads of authors who are quite categorical in saying that they think that aneurysms do not cause back pain. I think they can cause back pain if they're large enough. Personally, 3 centimeters or more, I think it's quite possible that an aneurysm can cause back pain. And certainly if there's an aneurysm of an iliac artery. The iliac arteries traverse anteriorly to the pelvic joint. And I have seen cases where aneurysms of the iliac arteries can cause sacroiliac joint pain. Now, before I was trained in ultrasound and I was a chiropractor, I didn't think that chiropractors saw many patients with aneurysms. Norman was obviously a notable exception. So having done my ultrasound training, I thought over this last year I'd look back and see how many aneurysms I have seen in practice here in Abingdon. And actually I've seen 8 patients with abdominal aortic aneurysms. 4 of those aneurysms have been less than 3 centimeters, so those wouldn't even get to be seen at the hospital. But they were aneurysms nevertheless, and they needed to be looked at because if they were expanding, then the hospital would be interested in them. 3 of the patients had aneurysms between 3 and 4 centimeters, and 1 of the patients had a large aneurysm which was more than 4 centimeters in size. Obviously, doing these sorts of investigative procedures can create some anxiety for patients, but so do all investigative procedures. And I must say that I was lucky to pick up Norman's aneurysm. Really, Norman picked up his aneurysm, and because it was detected and he had surgery, he went on to have a good number of years of good, healthy life. And so now when I pick up an aneurysm on a patient and a patient says to me, "Oh, thanks very much for picking up the aneurysm," I think, don't thank me, thank Norman. Bye for now.